Thanks so much for joining me on the Slice of Healthcare podcast. How are you today?
Great. Thanks so much, Jared, for having me.
Yeah, I'm excited. I know we spoke a few weeks back, got to know you a little bit, and your passion for music and
Yeah.
all the cool things you're doing at Vituity. So I'm excited for this day to finally happen. I think we should dive right into it. If you could tell the audience a little bit about your background, then we can go from there.
Yeah, great. I'm Andrew Smith. My favorite joke about my life is I was born in a hospital and I never left. It's always been a part of me, healthcare, trying to solve problems, improve the way care is delivered. Growing up, my father suffered from undiagnosed mental health disorder, mixed with substance abuse. It became just too much for him to handle. He committed suicide when I was 7, which obviously had a profound impact on my family. My mom immediately became a phlebotomist, was like, shoot, I need to work. I need to go to school. I want to become a nurse. I want to help take care of people. I want to make sure people have access to the care they deserve and need and should get every single day. So that genesis from my father's story, I see my mom go through, her whole life working really hard, going to school. My first job, she got me at the hospital as a patient transporter when I was like 15 and a half. And I fell in love with the underbelly of the hospital, just how it worked and how it smelled and how it just functioned. And I wanted to help fix it. And so that was really the genesis of my career. When I went through school, I always worked at different roles in the hospitals. I ended up working for a top 5 health system, spent a lot of time on standardizing the way care was delivered in each of their hospitals, as well as making sure access to specialists was really well thought out instead of the old school way of everyone having 5,000 different physician specialties in each hospital running there. And eventually that was great, but I wanted to move to the Bay Area and I found Vituity. My wife and I, we moved from Phoenix, Arizona. And the reason I chose Vituity for my home and why I really love working here and want to spend the rest of my career here is it's a physician-led organization. So one of the things at the health system that bothered me was we were constantly trying to convince doctors and advanced providers, PAs, NPs, how to do something instead of really having them on the cutting edge of what we were building, what we were working on. And so at Vituity, if I can convince a couple doctors and PAs and NPs to do something, we can go do something really fun, innovative, and hopefully change the way care is delivered for our patients. So now I'm the Chief Operations and Innovation Officer at Vituity. And I'm also the president of Inflect, which we're going to talk about. But part of my role is on the operations side, making sure that our clinical delivery through nurse consulting, operational consulting, industrial engineering is top notch, but also on the innovation side, how we disrupt the way healthcare is delivered through telemedicine, through data, AI, machine learning, and all the amazing startups that are out there in the world. I'm also a board member of our foundation, Vituity Cares, which is all built on serving people that need care that they just don't get. So social determinants of health, people in underserved areas that aren't getting the healthcare they deserve. That's the genesis of my family story. My career is just trying to do whatever we can to improve access to everyone in the world.
Yeah, thank you so much too for that intro. And
Yeah.
you're definitely very busy. You have your hands in a bunch of different cookie jars, which is really cool, and all kind of really under the same umbrella, which I
Yeah.
find very interesting. Which I also think helps, right? With your focus isn't going in necessarily in different directions; it's in the same direction. It's just with
Yep.
you wear many hats.
Every discussion I have, all of that comes up in some shape or form, right? And I can wear different hats a little bit along the way, but really for the betterment of care, increasing access, delivery through innovation, through investments, or through foundational work, the genesis is the same in the end.
Absolutely. Yeah. So you've obviously been at Vituity for what, almost 9? Is it almost 9 years
Yep.
now?
I'm going on 9 years. Yep.
So you were also there with that transition, like I guess a branding transition, right? From CEP America to Vituity.
Yep.
I don't think when we were kind of going through some stuff, we dove into this a little bit when you and I were speaking, but I think a lot of people still, it, you know, that's where they originally heard of Vituity, right? Was CEP America. Is it possible for you just to talk a little bit about that kind of, I guess, branding transition and
Yeah. No, it's a great story. Like all good startups, Vituity was founded like 50 years ago, just about, in the garage with two surfers that wanted to do something different, right? And that was emergency medicine. And that really came out of the Vietnam War. That was not so much a specialty before, right? And understanding how to treat trauma in the field, disaster management was really something we needed to launch in the United States. And so a couple of our founders said, hey, we can do this differently. We can be an equal physician democracy, a partnership. We can vote on things together. We can make sure people's pay is equalized. We're not going to have some partners making 10 times more than the other physicians. We want docs coming out of residency to be paid the same that we are. And we want to put our blood, sweat, and tears into this company. So that's how CEP America was founded. And it's an awesome story. And I got to know many of those founders, and that's a real privilege for me. But over time, we were so successful. Okay, now we staff 5 hospitals in California, then 20, then 50, then 100. Then we moved to Illinois, and we end up staffing 5, 10, 15, 20. And now we practice in 25 states. So Vituity was essential in the branding. We couldn't be California emergency physicians anymore. We weren't from California anymore. We weren't just emergency physicians. We were really becoming a national healthcare company. And CEP America was a really limiting name. And so Vituity was a massive endeavor, and not everyone was on board, as you could imagine, right? Like we had the same name for 40 years and then we changed it, but we are doing 15 specialties. We built a scribe company, a billing company, a practice management company, a navigation company, anything you needed to solve a problem in healthcare, we were building, and we had to rebrand around Vituity. And we're really proud of that. It's paid off in spades because people understand Vituity makes investments. We partner, we staff hospitals, we run urgent cares, and we do it all. And that was a really big milestone that a lot of people were scared of, but now everyone is so happy we did it.
Yeah, no, thank you for sharing that too, by the way.
Yeah.
When we first spoke, that was one of the really interesting, out of everything, we spoke a lot about a lot of interesting topics, but that was interesting to me, especially because I remember going to conferences, and I think I still have some business cards from people that were at CEP America.
Totally.
I actually didn't know it was for California emergency physicians, so that was a nice. I didn't realize that.
That got hard to answer that question at some point, right? When we're practicing all over the country in many different areas, and it's like that's what it stands for. So we came up with some other acronyms, but it wasn't right. We had to rebrand the whole thing, you know?
Yeah, absolutely. I would love to kind of shift focus. You mentioned it earlier in your intro. Let's talk a little bit about Inflect Health, what it is, what your role within it is, and we can kind of go from there.
Yeah. So about 7 years ago, we really started to understand how much data and technology was going to change healthcare. So Vituity started to invest in our own data organization, our own self-reporting structures, telemedicine. I'll never forget this because now during COVID, it's just so striking, but we built a telepsychiatry program and urgent care program, and we would get like 1 consult a week. We couldn't get anyone to get on video, right? And in 2021, we're going to see 1.5 million patients on video, which is just amazing, and I'm super proud of that. But at the time, we were like, can we keep these businesses afloat? How are we going to pull this off? A lot of people questioned what we were doing, but we knew mental health was a huge area of opportunity for us to have an impact. We knew that urgent care, making sure we could take care of family at home, meeting patients where they're at, was a huge deal. And 7 years later, it's paid off in spades in the investment we put in it. But we really decided, like, we have to branch out. We have to meet patients in new areas. It's not just about the acute care continuum. It's really about taking care of patients pre-hospitalization, post-hospitalization, and anytime really anyone needs anything. So that turned into making some really slow investments in some startups. And it just, we realized we need to rebrand this, create an innovation hub, and go all in. And so that's what my team and I, Dr. Rick Newell, Lindsay Krieger, we have about 20 people on our team. They're like family, the most amazing people. And that's where we started Inflect. So Inflect Health is a corporation that hangs off of Vituity, that I'm the president of. Rick is the CEO, and our team, we go out, we try to find the most innovative ideas, the most innovative startups, try to help them design what they are building, make some financial investments in them, and see them be successful. I think what makes us unique is we love early stage companies. So pre-seed, seed, that's kind of our sweet spot. We love to make a financial investment, but also try to pilot things, right? We practice in 25 states now. We see about 7 million patients a year, and there's about 5,000 providers that you can pick the brains of. So for a startup, that's an awesome opportunity to try some things, see if it works. It's a great opportunity for us because we think someone else is going to disrupt healthcare. We're not naive and think that we know everything about healthcare and we're going to solve all the problems. We really have met so many incredible entrepreneurs out there that have great ideas that we think are going to disrupt healthcare. So Inflect was based on that, to go partner with new companies to make a huge difference.
Yeah, no, thank you for sharing. I found it interesting going through kind of the portfolio. One of your portfolio companies being Curve Health. We actually had their CEO on the podcast recently,
Yep.
which was a really cool conversation. Yeah, no, you have some very, very interesting companies in the portfolio. What I found so interesting too when we first started speaking to is just this sounds bad for the industry as a whole, but not for you guys. Your organization places such an emphasis on innovation, and it's not like it's a spring chicken, right? You've been around for a while. That is such a rarity, especially in healthcare. So, kudos to you and your team for all the innovation that you're doing.
Yeah, I think for me, the physicians, nurse practitioners, advanced providers, nurses that we work with, they're really motivated to change a broken system. And that's why I love Vituity and was a little bit overworking at the health system. Was we could cook something up with 3 docs and a nurse and try it. And they were willing to do it. And that's awesome. We basically started an entire navigation company on one hospital in Illinois. A couple doctors said, "Hey, we need a navigator, and let's hire one and try it." So they contacted us. The innovation team partnered with them. We built them a virtual navigation program, and it went incredibly well. They reduced revisits by 40%. Their follow-ups went up 80%. The doctors were happy. The navigators were happy. The hospital was happy. And now we navigate, 100,000 patients easily in a couple months. But there was just one little site that tried it. And I think that's what's really makes Vituity unique, is if you can get the little spark going, the whole organization can get behind it and try to roll that out.
Absolutely. Well, Andrew, I want to thank you so much for coming on the podcast and sharing your story and Vituity. And it's been a real pleasure. Hopefully we can have you on again at some point. Where can people, if I guess they want to get in touch with you or learn more about the companies you're involved with?
Yeah, great. LinkedIn, andrew.smith@vituity.com. You can see us on Inflect Health, our website. You can see all of our portfolio companies. You can contact any of us. My team is much cooler than me, so you should talk to them. But I'm always happy. I'd love to come back and talk about mental health and my personal story a little bit more, and what we think is going to change the world to better treat behavioral health, mental health patients. So thanks for having me. This is a great podcast. I love listening to it and look forward to the next one.
Yeah, thank you. I really want to have you come back on. The goal is to have a lot of our guests start coming back on. Number one, because everyone has additional interesting stories to tell and interesting topics that we can dive into. And then number two, we have plans to have a lot of podcasts, and at some point there's not going to be, a million guests that you can choose from. So bring on the guests that work and hear more of their knowledge and wisdom.
Awesome. Thank you so much.
Thank you.